Varicose veins are more than just unsightly. They can cause aching, pain, and discomfort, and they're not just a problem for the elderly.
That's right, and for some people it can be a red flag for a larger circulatory problem. So Dr. Deborah Manjoney is here now from the Wisconsin Vein Center MediSpa with more on the causes and treatments of varicose veins and venous disease. Good to have you here.
Thank you. Glad to be here.
I know. I think this is one of those things we talk about a lot on the show, but it's really important because it can signify a deeper problem.
It can signify more of a problem than people realize, and actually, a lot of people start getting varicose veins when they're quite young, and it may not be that obvious, and they don't think about connecting it to maybe some symptoms they're having.
Right.
We've seen people as young as 13 with varicose vein disease.
That's amazing.
And we see young athletes who have to put their legs up after they run because they're just so fatigued and they're so achy, and they don't realize it's not from their running, because not everybody feels like that. It may be from having a vein problem.
What would you say is the main cause?
Well, a lot of it is hereditary.
Okay.
Sometimes we actually see a little congenital abnormality, if the veins coming out a little different direction from it should, because there are some variations, but very often it's just because of the hereditary tendencies. Their parents have varicose veins, and so a younger person is likely to get them at an earlier age, and lifestyle does play a role too.
Okay. So are there other risk factors within lifestyle or things like that you can pinpoint?
Yes, there are. Certainly people who stand on their legs a lot without walking around.
Servers.
Absolutely. Servers.
Service people.
Nurses. Doctors in surgery, hairstylists, all those people stand still for long periods of time, and even people in retail. They're standing a lot. And so cashiers at countertops really, have problems sometimes with the aching and all. So those lifestyle changes, because they're not activating that muscle pump in their legs to empty the blood, because the veins are returning the blood to the heart and lungs after the oxygen's been removed, if they're not really doing something to actively empty those veins, the blood can just be pooling there if they've got that hereditary risk.
Now, how much a factor is pregnancy?
Well, pregnancy can lead to more varicose veins for several different reasons. It's not just the size of the baby, which many people think it is. With the first pregnancy, as your uterus is relaxing, it's progesterone circulating in your body, but that relaxes all kinds of muscles. And so the veins can stretch out. Usually it pops back after the first one. After the second, it may not come back as well. And after the third, you can almost guarantee that if somebody's going to have varicose veins, they're going to get them after and have them stay out after their third pregnancy.
So a lot of times mothers and young mothers are told don't do anything about them until you're done having children. Is that good advice or not so good?
Not necessarily. People can be very, very symptomatic when they're pregnant. And we see this all the time, and they're wearing compression stockings and having to pull those stockings on while they've got a big pregnant belly. And they can be extremely uncomfortable, painful, to the point where people can't function very well. And so don't keep putting up with it if that's the case. So veins, normally the blood is going up back toward your heart and lungs, and then with the relaxation of a pulsation in your body, the blood comes back down and it's stopped by those little one-way valves. And so that's the normal function of a vein. We have valves every 3 or 4 inches up the vein to prevent blood from falling back. But sometimes those valves will stretch apart as the vein stretches, and then you've got blood just kind of mixing and not getting out of your veins the way it should, not going back to your heart, and so it just settles and pools in your legs. And it's especially legs that are affected because we're upright creatures, and those are the areas affected by gravity. So then varicose veins can form because these are the veins that are closer to the surface of the skin, and so the veins elongate in order to accommodate more blood. And so we see a real bulging thing. I say like it's a line in Disney World. They'll zigzag the line to get more people in that certain amount of space. Same things happen with the vein. It's going to get all zigzag and like that to accommodate more blood.
And that's what you see in your legs sometimes poking out, or just in the even in the varicose. So what's the diagnosis like?
Making the diagnosis is extremely easy because it's all done in a painless fashion. We use ultrasound to diagnose the problem. We do it with people standing up, and so we're able to look at the vein function with gravity effects. And so mostly it's superficial veins, the veins that are located between the skin and the muscle, and we're able to look at those trunk veins that run lengthwise in your leg and see what's functioning and what's not to determine if that's what the cause of the branch varicose veins that we see.
Okay, we're almost out of time.
Yes.
But talk about, so when you start treating, there's laser, there's sclerotherapy.
There are all kinds of very easy ways today. It's such a huge change in treatment of varicose vein disease in the last 15 years. Everything is done in a minimally invasive fashion through just needle punctures with the tiniest little devices used. So people heal very, very quickly. There's much less bruising. They're able to get up and move around. You do normal activities within an hour. Walk in and walk out. Exactly right.
Oh, look at that before and after.
Yeah, they're really
How many treatments does something like that take? That's one treatment?
Yes.
That's phenomenal. I mean, think about how many people, you think about the leg that you've got, you think about seeing it on your legs, you're thinking about wearing shorts, getting out for gardening, Memorial Day, things like that. You know, I'm embarrassed, I don't like the look. You know, you don't have to live with it.
You do not have to live with it.
And insurance covers
and insurance
a lot.
covers almost all varicose vein problems when people are symptomatic, and that's very important to know.
Huh. That's phenomenal.
Great information.
Yeah,
thank you.
Absolutely. Here's how you can contact the Wisconsin Vein Center and MediSpa. Definitely the professionals here. They're in Pewaukee. The phone number to call is 262-746-9088 or visit online at wimedispa.com. It's obviously important for your health, but aesthetically too. You're going to be much happier to wear those shorts.
Summer is here.
Yeah. Thanks, Deb.